Okay guys, in this next video we're going to be looking at the core integration section of our correcting low back and knee dysfunction home corrective exercise program. So in the previous video I went over the core activation and also the glute activation as well, and kind of how you can kind of tie those together. Okay, and in this video we're going to be doing a little bit more of the same, but using a different exercise known as the bridge. So we're going to be using that to again get glutes and core working together. I'm going to show you a few other techniques on how you can do that. The main technique we're going to be doing is the main exercise rather is going to be the bridge exercise. So this is a very familiar one. A lot of you maybe have done this before, but there's a few things I want to go over just to make sure that we get the most amount of glute activity. Again, I'll show you how we can minimize hamstring activity, and also how we can maximize core activity and reduce any extensor muscle activity as well. So that's important that we do that. Remember that in this dysfunction, our glutes and core are the primary muscles or group of muscles that have shut down, and we really want to increase their activity, but we don't want any extra hamstring activity, because remember that muscle, our hamstrings, get, especially our bicep femoris muscle, which I spoke about before, becomes dominant for our glutes, which have shut down. Our hamstrings tend to take over the role, and then that causes some problems and dysfunction unto itself. So we want to have less hamstring activity, more glute activity, definitely, and of course with core. So what you guys can do, I would recommend getting a band. Okay, so research shows that having some resisted abduction, which is basically just having a band around your knees, kind of in this position, and just resisting that inward pull of the band, so stopping the band from pulling your knees together, significantly increases glute activation, which is great. We want more of that. So that's going to be the first thing that we're going to do. Okay, so we're going to use a band. Use a strength that is applicable to you. That's going to be challenging. Nothing so strong that we can't do that. We can't maintain our pelvis, our knees, in line with our second and third toe. If it's putting our knees too close together, that's not going to be helpful. So make sure it's something that you can adequately resist. Okay, and we're going to lay on our backs. Okay, in this position. Okay, and I'm going to do my drawing in maneuver. I'm going to pull my belly button back in towards my spine. Okay, that's going to activate my deep core muscles. That's going to switch them off. Sorry, that's going to switch them on rather. That's also going to get some of my extensor muscles in my low back to calm down, which they've become a bit overactive, so that will shut them off. Okay, I've got that tension on that band there. I've got my core drawn in. The other thing I want to do is I want to pull my neck, my heels as far in as I can to my backside. And what that's going to do, the greater angle I have of knee flexion. So this is knee flexion, that's knee extension. So knee flexion is when I bend my knee. The more knee flexion that I have, the greater angle I have there, means that there's going to be less hamstring involvement and more glute involvement. So I'm going to get the hamstrings to shut off, and I'm going to have just pure, or close to just purely glutes. Okay, which again is exactly what I want. And all I'm going to do in this position, so core drawn in, and I'm going to be squeezing my glutes. That's going to help to switch those glutes on, and I'm going to be pushing my pelvis up off the floor, maintaining some tension on that band. I'm going to hold it for 2 seconds, and I'm going to come back down. 3, 2, 1. I can add my hands now for a bit extra stability if I want, or I can bring them up if I want to make it harder. I can bring my arms up, and again I can just push up, squeeze my glutes, core in, hold it 2 seconds, come back down. 3, 2, 1. Keeping that tension on the band, not letting my knees come in. Okay, so tension on the band, up, squeeze my glutes, hold it. 1, 2, and then back down. 3, 2, 1. Drive it back up again, squeeze my glutes, hold it, back down. 1, 2, 3. Okay, so that's my basic bridge. Okay, so if I want to make that harder, there's a few routes I can go. I could do that on a stability ball, so those big gym balls. I could do the same thing. That's going to increase the proprioceptive demands. That's going to help get a bit more glute and core activity. The other thing that I can do as well, to really get more glute activity, this is going to be harder. Again, I can keep the band on for this as well. Is I can do it on one leg. Okay, so again, I can start with my hands down. Again, I'm going to you know, bend my knee as much as possible so I get pure glutes. I can bring this leg up, and then what I can do then is I can squeeze, I can push up through the heel, squeeze that glute, get that leg up, get that pelvis up as high as I can off the ground, hold it, 2 seconds, come back down for 3. So this is my single leg bridge. And again, drive it back up, push up and hold it, squeeze it for 2, come back down 1, 2, 3, push back up and hold it, squeeze, hold it, 1, 2, back down 3, 2, 1. Okay, so I'm going to be doing those for 12 to 20 repetitions. Okay, I'm going to be doing a 3-2-1 tempo. So I'm going to push up for 1, I'm going to hold it for 2 seconds, and I'm going to come back down 1, 2, 3. So each set of these should take anywhere from 70 seconds to 2 minutes in total. So you should be doing it for quite a while. So 12 to 20 reps, 3-2-1 tempo. I've got my floor bridge. I can do my single leg bridge. I could have it with my hands down or with my hands overhead. Like I said, you could do that on a stability ball as well. That's definitely effective. If you guys have ever done those hip thrust exercises, they're great glute activation too, so you can definitely do those. Or on one leg. You guys could also, if you've got some dumbbells, you could place a dumbbell on, just below your pelvis and use that for resistance. You can definitely do that. The other thing I guys want to show you as well to help get some more core activity. So our transverse abdominis and those deep core muscles, they help to resist rotation. They basically help to keep our lumbar spine where it is, and it really helps to resist any kind of rotational forces. So a great way that we can get the glutes and get that TVA fired up even more and working together, which we really want, especially when we're correcting this kind of lumbopelvic hip dysfunction, is what I can do is I can take this band, okay, I can go back into that bridge position. Okay, so I've got a band attached just above the camera, and that's going to try to pull me this way. So if I resist that motion, I'm going to do that drawing in maneuver at the same points as before, reach my arms up, and now I do my bridge and resist that rotation, resist it from turning me to the left. That's going to really help to increase the demand on my deep core muscles. So it's going to make this exercise a lot harder. And I'm going to be doing 12 to 20 reps, same tempo. So up for 1, I'm going to hold it 2 seconds, come back down 3, 2, 1, back up, hold it for 2, come back down 3, 2, 1. If I want to get real crazy, I can do that single leg variation up, hold it for 2, down 3, 2, 1, push up again, squeeze my glute, back down 3, 2, 1, which gets super tough. I did some of those earlier. So again, that's another way we can integrate glutes with our deep core muscles. So we definitely want to do those clams, sideline leg raise, prone hip extensions, do those quadrupeds as well, maybe with the hip extension as well, which I did in the previous video. And then definitely we want to bring some of those bridges. I mean, those bridges alone show really good efficacy for increasing glute activity as well. So, which is really handy. So we want more glutes, more core activity.